Hello everyone, today we are going to talk about indicators of normal health and behaviors in horses and conditions for which the vet should be called. Domestic horses' life are complex, especially athletic horses, and they have been put pressure on their abilities to meet our expectations and thus at risk of being sick. According to Oxford Guide of the English Language, sickness refers to not only a state of being sick, but also physical and mental discomfort. Although pain itself is not always negative, it is a mechanism that protects the body by inhibiting activities that lead to further damage. The complex relationship between illness, stress, and pain, disease accompanied by pain, could exhibit in the form from mild discomfort to acute pain, which has made assessing illness precisely always been a challenge, as it requires that the identification of reliable indicators of the disease. Indicators are meant to mark the changes from a homeostatic state of well-being that correspond to changes in the internal state. Sick horses may become unresponsive to their environment, and subtle changes of behavior like reduced appetite or amount of water intake. Or sometimes the situation could go down very fast before you realize you need to call the vet for emergency. So it is always helpful to spot the early signs. Horse people always want a perfect and wonderful horse, but the premise is the horse is healthy, fit, and happy. Healthy and fit horses are able to endure the amount of work we require. A happy horse is willing to cooperate with our commands. First of all, you need to know your horse's normal state when they are healthy. Vital signs, appetite, attitude, weight, and body condition, posture, thirst, and defecation. When assessing the horse's health condition, the resting vital signs should be within normal limits. Resting temperature around 37 to 38.5 degrees. Pulse varies from 28 to 44 beats per minute, and the respiration rate varies from 8 to 15 breaths per minute. When you observe the horse should be alert and responsive, with bright, clear eyes and moist salmon pink mucous membranes. Pale or white membranes could indicate shock, anemia, dehydration. Red could indicate fever or toxicity. Blue indicates low oxygen moving ability. Yellow indicates liver issue, and the gum able to return to normal color within 2 seconds after light pressure. If capillary refill time is more than 2 seconds, it could indicate shock or dehydration. The coat should be shiny and smooth, reflecting good nutrition and the absence of parasites or dermatitis. The horse has a normal body condition score, neither too thin nor overweight. Their appetite and thirst are consistent and could produce well-formed manure and adequate urine. In motion, they could move freely without lameness or stiffness. Gut sounds are audible and regular with gurgling, gas-like roars, occasional roaring. Horses are prey animals. Their survival instinct depends on their alert perceptions of surroundings and flight response. A good horse caretaker must be aware of this and understand and respect their natural instinct. They could choose to flee when they perceive threat. However, they could be desensitized from threatening stimuli through positive reinforcement. Every species has its essential and special requirement for their living environment. Their life quality could be compromised if it is not fulfilled. Horses are herd animals. Free movement, social contact, and companionship. Social contact and free movement are basic needs, and it is good for their physical and mental management. When we look for illness indicators, most of the time we relate them to health problems but not welfare evaluations, even though they are fundamentally related. However, suffering is very common and underestimated in equine population, mainly because our recognition of their discomfort is poor. That's why there is a demand for clear and simple indicators of illness in horses. Abnormal vital signs such as elevated temperature when resting could indicate fever or inflammation that could lead to laminitis or colitis. Rapid pulse could indicate nervous, anxious, or pain. Rapid or labored breathing could be a result of hot, humid weather, or it could indicate the horse is in fever, pain, or respiratory disease that warrant immediate attention. Other signs include nasal discharge, especially colored, cloudy, or sunken eyes, lameness, stiffness, changes in manure consistency, for example, diarrhea or very dry hard stools or very little poo or walk away from before completion urination, dark color or abnormal amount urine. Abnormal range of vital signs, low or high temperature, pulse, and respiration rate. Any signs of pain such as lameness, powing, rolling, or flank watching could indicate colic that require immediate veterinary emergency. A horse with compromised health may display subtle or obvious changes. Lethargy, dullness, or changes in visual behavior like isolation from the herd, depressed or agitated, pain face and are red flags. A dull, rough, or patchy coat suggests nutritional deficiencies, poor nutrition or stomach ulcers. Weight loss or gain without an obvious cause or decreased or increased appetite and thirst are concerning. Sometimes you walk into a stable and see a horse weaving or walking around. Don't take it for granted. These are not normal behaviors. Weaving could be the horse is bored, having excessive energy that leads to poor performance or tendon stress. Stall walking could indicate the horse is bored or stressed. I see a lot of race horses have this behavior when there's someone walk past their stable. They show signs of aggressiveness, especially when they come back right after a race. Some of these behaviors become less after they rest for a month or so. It could be very possibly result from race stress. Stall kicking could indicate the horse have too much energy, not getting along well with his neighbor or being territorial. Again, very common when the horse come back after the race. You might need to leave him in a quiet stable. Powing could mean the horse is being impatient or pain. If he looks at his flank, it could also indicate colic. Some colic horses could also roll or lying down looking at the belly. Wood chewing is said to be caused by lack of exercise or nutritional deficiencies. You might need to consider add some minerals in his feed. According to Zimmerman, pain in animal is an aversive sensory experience that leads to protective actions, results in learned avoidance, and may modify species-specific traits of behavior, including social behavior. Behavior changes in horses could indicate illness in many ways. Sudden lethargic or withdrawn can be the sign of pain or infection. Sudden decrease in the appetite or a refusal to eat can indicate various issues like colic, dental problems, or fever. Increased water intake can be a sign of conditions like Cushing's disease. Lameness could be a result of complex musculoskeletal problems. Excessive swelling when resting could be a sign of pain or fever, infection or inflammation. Consistent head tossing could mean the horse is painful, itchy, or have a bug in the ear. Change in urine and feces, decreased feces could be sign of colic. Increased urine could be sign of Cushing's disease. Grinding teeth could indicate pain, dental problems, or colic. It is worth noting that if a horse does not sweat like others, it also indicates health problem. He could be burning inside and needs cool down more frequently than normal horses. Difficulty breathing, snoring, or other respiratory sounds can indicate problems. Abnormal posture or gait, such as a horse leaning against the fence or having a stiff gait, can indicate neurological or musculoskeletal problems. So when should we call a vet? Equine veterinarians should be consulted for a variety of conditions, ranging from emergencies to less urgent but still important health issues. Severe bleeding, especially if the bleeding does not stop with pressure. Large wounds that cannot be controlled, obvious bone fractures, wound penetrating joints or body cavities, injuries preventing weight bearing, collapse, severe colic, laminitis, prolonged or abnormal sweating, and your behavior like aggression or lethargy. Signs of serious illness including fever, dehydration, lack of appetite, fatigue, and your discharge from the eye, nose, or other areas. Consistent choking or diarrhea lasting more than 24 hours, especially if accompanied by lethargy or decreased appetite. Blood in stool or urine, or blood coming from the eye, nose, or mouth. Neurological signs like stumbling, incoordination, seizures, or sudden behavior change, or unconsciousness. Difficulty breathing or choking, known exposure to dangerous poisons, chemicals or medications or pellets. While pellets, we should know that horses overfed with pellets could lead to serious and potentially fatal conditions like colic and laminitis. This is a fact that could be easily avoided by secure your feed room and feed under good management. Overall, as a horse yard owner, we need to take care and make sure everything is safe for horses. Bedding twine left in the stable could be eaten by the horse and cause choking. Sharp edges or slippery surface could lead to cuts and falls. Lessons could be learned from real life or by having more knowledge to prevent it from worsening. We, of course, would prefer the latter one, as we would love our horses to be healthy. Important considerations: know your horse's normal behavior. Being familiar with your horse's normal habits will help you identify subtle changes that may indicate problem. If your horse got kicked by other horses in the pasture, you would rather rest her a few days than ride her in the competition next day, right? Don't hesitate to call your veterinarian. Early intervention is crucial. Challenge for vets is early identification of illness. Owners, riders, or grooms who have access to horses' daily life are very helpful in spotting problems. Sometimes you trot up a horse in a straight line, the horse is perfect, but the rider who rides him feels he's not pushing with the right hind. Those subtle clues could help complete the whole puzzle. Addressing problems early can prevent them from worsening and improve the chances of a positive outcome. If you are concerned about your horse's health, it is always best to err on the side of precaution and contact with your veterinarian. Thank you.